Hi students, we're doing chapter 10, anti-infectives, antiviral drugs. Let me get this to the slideshow. Okay, fine. Alright, chapter 10. I will not be reading the objectives. Alright, the virus. So basically this is a picture of an actual virus. There are two different types of viruses. We'll go into that shortly, but this is actually what the anatomy of a virus looks like. Intracellular microscopic parasites that must infect the living cell to produce. So they're just like a tick that goes on a dog and uses the dog to live because it sucks the blood. Same difference. Virus needs a living host to infect. And there are two types. You have a common virus, which is a non-retrovirus, and then you have a retrovirus, which are treated with retroviral drugs, and of course common are treated with antiviral drugs. Common viruses have low efficiency. I'm not sure if I said it backwards in class about efficiency, but I just want to clear it up now. I kind of gave it to you a little unprepared in class, but I am prepared now. Common viruses have low efficiency, meaning it takes a large number of virus particles to infect the person. So in other words, it really does take a lot of the virus to infect a person. A person will not get sick from a virus unless the virus outnumbers the person's immune system response. So basically, in war, whoever has the biggest army wins. Same difference. Also noteworthy with viruses is that most people only become ill within a specific viral disease once. In other words, you get a disease, you get a virus, whenever you get sick, then you start to develop antibodies. So you really only get sick from a virus once. Alright, moving on to the next slide. Antiviral therapy is virostatic in that it reduces the number of viruses by preventing them from reproducing and growing. It does not kill viruses. Okay. The intended responses would be to shorten the duration or intensity of an existing viral disease, prevent reactivation of a dormant viral infection, prevent a viral infection from multiplying to the point of disease. Allergic reactions are always possible when you're given any drug, but particularly antiviral drugs, and the more serious reactions occur when given intravenous IV antiviral drugs. I'm not sure where you guys are going to work. I guess at this point, neither do you. But if you're in a capacity where you're giving retro or antiviral therapy drugs via IV, understand any drug you give the first time IV. Usually we flag that with a sticker if it's applicable to wherever you're working, but typically in the hospital the way we do it is there's a first dose sticker, and we place this first dose sticker in the chart, and we document the reaction to the first dose. So you would be required to do the same thing with an antiviral drug. Particularly with antiviral IV drug, you would be required to do that and watch them for 15 minutes, because whatever reaction they're going to have it within the first 15 minutes of administration. Also noteworthy to understand, you must tell your patients to take their antiviral drugs directly as prescribed. The reason for this is that, the goal of antiviral therapy would be to suppress the virus so that the person isn't getting sick anymore. If they're not taking the medication consistently, the level of suppression won't be adequate, and it will allow the virus to replicate and get stronger and smarter because it knows you're giving it. It's the same principle behind antibacterial therapy. You definitely have to worry about resistance. So make sure you tell your patients to take their medicine. Okay, so if you look up here where it says acyclovir and valacyclovir, basically the rest of the slides pertaining to antiviral drugs are going to be part of the drugs under the drug class antiviral drugs. So all of these drugs will be listed under the class, as I just said. Acyclovir and valacyclovir, it's really important to note what the mechanism of action for every drug is in order for you to understand what it's doing. And a lot of times you can kind of predict the side effects based on the mechanism of action. All right, and maybe that'll take some time for you to do. All right, so for acyclovir, even though it's not listed here, for some of them they are listed within the slide. For acyclovir, basically acyclovir and valacyclovir forms a counterfeit DNA to stop the enzymes from completing. As well, it slows viral replication. Most effective against Epstein-Barr virus, cytomegalovirus, herpes simplex 1 and 2, and the varicella zoster virus, which is the chickenpox. Side effects: headache, dizziness, nausea, vomiting. Adverse effects: reduced kidney function leading to damage and failure. You would be expected to memorize side effects, adverse effects, understand the mechanism of action for every drug class, and recognize what drugs fall under which drug class. Check before and after. You can read this on your own. We do not do pediatric and pregnancy considerations. However, older adults, you want to note dizziness, agitation, confusion may occur as a side effect. Monitor for kidney function. Remember, everything is diminished with older adults. And no driving or operating machinery until the drug's effects are known. Amantadine, romantadine, same thing. It blocks the encoding of influenza A virus, stopping release of viral particles in the respiratory epithelial cells, preventing infection. So it gave you the mechanism of action. Here are the side effects and adverse effects. Check before. Patient teaching is very important. Patient teaching is related to mechanism of action. So if you understand mechanism of action, you can already predict what you're going to teach your patients. If you don't understand mechanism of action, looking at the patient teaching will help you understand it. Older adults, everything is diminished. These guys are increased risk of side or adverse effects or side effects. Ribavirin suppresses viral action and reproduction, used for viral infections that do not respond to other antiviral agents. Check before and after. Older adults. And again, all of these drugs are within the antiviral drug class. So you can make a chart. You can use these slides as an outline to help you organize the information. The key to learning Pharm is not memorizing every single drug, but learning how to organize the information and memorizing a small amount of information that apply to many of the drugs and drug classes. And that is the goal. Okay. Alright, so part 2 of this, we want to talk about retroviruses. And really quick, what I'm going to do, because this thing only gives you 15 minutes, really quick, what I'm going to do is show you, I created or found a website that allowed me to do an electronic whiteboard. And on this electronic whiteboard, I didn't mean to do this. on an electronic whiteboard, I was able to draw essentially what I would draw in the class. Okay, I'm going to explain what all of this is. This is my drawing. I had to do this for about 20 minutes or so trying to draw this stuff. Very, very difficult to draw words. So, pardon me if it looks like I'm writing in first grade, but it's really difficult to write with this stuff, believe it or not. Okay, so I want you to basically, I'm going to explain to you how HIV infects a cell. And based on you understanding how HIV infects a cell, will you be able to understand how the drugs work, why they prescribe drugs, why there are cocktails to the drugs, etc. Okay, so pretty much this is the actual HIV virus. It represents the picture of the virus that you saw in the beginning of the slides. And basically, everything happens in steps. HIV looks for cells that want them, says come to me, or cells that are vulnerable to allow themselves to be infected. In other words, someone who left the gate open. That's who they're looking for. And CD4 cells would be your helper T cells. And these are the cells that HIV infect. And it's actually CD4 counts is what we measure to determine how infectious you are with HIV. So basically, the HIV virus particle docks onto the CD4 cell, and as it enters the CD4 cell, goes through a number of steps. Step one, step one, HIV goes inside the cell. HIV only has RNA, it does not have DNA. The goal of HIV, which is very gangster, is to go in, set up shop, and take over the cell and go hunt for other cells to do the same thing. So HIV enters the cell through the dock, goes down. In order to get DNA for HIV, the RNA copies the DNA of the cell, and now the HIV has DNA. Again, remember, DNA does not exist, and HIV virus only RNA, so RNA copies from DNA to make DNA, copies human DNA to make DNA in HIV. And the enzyme that's responsible for doing that is called reverse transcriptase. So as it goes into the cell, integrase is the enzyme that is used to insert the newly formed HIV DNA into human DNA. Now, at this point, the person is considered infected. All right. So then the next step, which would be step 4, now HIV uses the cell's machinery or uses the cell's materials to make HIV particles, which is these particles you see floating around in the cell. I'm sorry, this circle here represented DNA or human DNA. I apologize for that. Now that we have HIV particles floating around in the cell, step 5 is the HIV particles form a long protein strand, which is here in purple. Step 6, protease is the enzyme responsible for cutting the protein strands into fine particles such as this. The only difference is now the structure of this is different because now it has HIV genetic material as well as human genetic material. So when it clips back into these particles, those particles line the cell membrane, and now it effectively controls the cell and goes to other cells to infect it. And that's basically what it does. Now, what is noteworthy is the fact that HIV has multiple strands, and the reason why is because every time protease clips the protein strand, it clips it in a different way. So you're not going to get the same particles that you got from the last clip, which is why HIV is so hard to kill. Okay. So